So you've clicked on this video because you have knee pain and you don't want to be making it worse by doing the wrong exercise at the wrong time. So I'm going to explain some of the diagnosis around knee pain so that you can know exactly what you're dealing with so that we can get you on your way to fixing it. In this video, we're just going to be covering pain at the front of the knee. So if you've got pain at the back of the knee or the calf or the hamstring, then this video is not for you. So if you've got pinpoint pain, which is very localized and tends to be within one of these three positions, and it includes high kind of like tendon stress activities like jumping, landing, you've got Olympic weightlifting, those type of activities, then you're most likely dealing with tendinopathy. Now, on the other hand, if you're quite young, you participate in sports and you've got a bit of a bump at the front of your knee, you're probably dealing with something called Osgood-Schlatter's disease, which is growing pains. And if you've recently had a fall or direct trauma to the front of the knee, then you might be dealing with tendon pain, which occurs across the whole tendon. One of the more common ones is patellofemoral pain. So this tends to be worse with bending activities such as squatting or lunging or anything kind of where you have to bend the knee. A common characteristic with patellofemoral pain is that the pain is quite dull, so you don't really get any sharp pains, but you will notice that it feels either directly behind the kneecap or around the kneecap itself. And sometimes you might notice that the pain location might change on different days. If that's the case, you're probably dealing with patellofemoral pain. Now this one's an easy one. If your knee dislocates or sometimes slips out a little bit, then you've probably got patellar instability. Now if you're a middle-aged woman and you get intense pain on either side of the kneecap, then you're probably dealing with Hofer's fat pad. Wearing heels you might find actually feels better when you're dealing with Hofer's fat pad, and extending the knee all the way tends to make it worse. So the next few videos I'm going to be covering each of these diagnoses as well as what exercises are the best to perform for each of them. So if any of these symptoms sound familiar to you, then make sure to hit that subscribe button so you can stay in the loop. Peace for now.